Greetings, good morning, and good afternoon. I want to welcome you to this special webinar being produced by the American Psychological Association and the National Caucus and Center for Black Aging. I welcome you on behalf of both organizations. My co-host Angela Body is unable to join us this afternoon. We want to talk today about a critical issue addressing the mental health needs of African American older adults. This work is consistent with our broader work to center equity in the coronavirus pandemic response. Obviously, the policy response to the coronavirus pandemic has been uneven. We're currently seeing a resurgence of new cases of infection, but we need to be concerned about those populations that are particularly at risk for infection and for poor outcomes if they happen to get infected. This includes older adults as well as people of color. We know that the coronavirus pandemic is disproportionately affecting Black and brown communities, as well as many others who are at risk, including people who are incarcerated or are otherwise in institutional settings. Our focus today on the needs of African American older adults is part of a broader initiative that we call Equity Flattens the Curve. We know that physical distancing is necessary to help flatten the curve, but we also know that social cohesion is important to help flatten the curve and to prioritize the needs of our most vulnerable and marginalized populations, such as older adults and people of color, and in this case, the intersection of those identities. Equity Flattens the Curve seeks to do four things. One is to bring together the diverse voices of advocates in behavioral and mental health professions, health equity, public health, as well as other fields. We know that there are special needs that older adults have during this time. There are special needs that communities of color have during this time. We seek to connect the voices of those groups advocating for those populations as well as many others, such as the needs of women, the needs of people who are sexual or gender minorities, the needs of those who are differently abled. By connecting our voices together, we form a much more powerful voice so that policymakers can do the right thing to ensure that equity is our top priority in the pandemic response. Second, we seek to marginalize voices of hate and intolerance. We're seeing that over the course of the pandemic that some groups such as Asian Americans have been unfairly targeted with racist and xenophobic hate speech and actions. We're seeking to harness the best of psychology so that we can understand how to safely marginalize those voices of hate. Goal three, the other side of the coin of marginalizing voices of hate, is bringing together communities to form strong, cohesive bonds. We know from prior literature that communities that come together during times of crisis to form effective units, being able to come together to work and build collective efficacy is part of what's necessary to help flatten the curve and to mitigate the virus's spread. Finally, we're advocating for the policy needs of those communities made most vulnerable, such as expanding federal and state safety net programs, such as unemployment insurance, housing assistance, food assistance. All of these programs are critical to address the needs of those populations at risk, particularly those who've been affected economically. And finally, we want to ensure better data collection, more comprehensive demographic data collected and reported by state and local governments to help us understand where the virus is spreading and how we can best mitigate that spread. So I thank you again for joining us for this important webinar. I'll now turn it back over to Sonia Wiggins to introduce our panelists. Thank you.
Thank you, Brian. First off, I'd like to introduce our speakers for today. Our first speaker is Francis Adamoko. Francis is a counseling psychology PhD candidate at Harvard University. Francis' work explores race-based stress and trauma and engages with community organizations, research, and public policy. Her clinical work focuses on race-based trauma and post-traumatic stress disorder. Our second speaker is Dr. Vonetta Dotson. Vonetta Dotson is an associate professor of psychology and gerontology at Georgia State University, a senior project specialist at NASA, KBR, and founder and president of CerebroFit, Integrated Brain Health. Dr. Dotson's research and clinical activities focus on positive and negative modifiers of brain health, including the intersection of depression with cognitive and brain aging, and the impact of health disparities on brain health. And our third speaker for today will be Ms. Angela Telsford. Ms. Telsford is a job counselor trainee with the Senior Community Service Employment Program at the National Caucus and Center for Black Aging Incorporated. She assists older adults to find employment opportunities and build skills, self-confidence, and lifelong learning. She is passionate about social justice, advocacy, and helping loved ones in crisis. And now we will begin with Frances Adamoko.
Thank you, Ms. Wiggins. So I want to begin our conversation today by providing you with some additional data and then discuss what may account for these disproportionate impact of COVID-19 on African American older adults. So as Dr. Smedley noted, we know that the impact of COVID-19 is disproportionately impacting older adults and racial and ethnic minorities in general. While the data on this is still emerging, recent data from the Center for Medicare and Medicaid Services showed that African American Medicare beneficiaries have been hospitalized 4 times more than white people and also contracted the virus nearly 3 times as often as white people. Generally, those on both Medicare and Medicaid were far more likely to get the coronavirus. And when we think about African American older adults and what may account for these differences, there are many, many reasons, many of which speak to long-standing inequities that exist in our society for African Americans in general, and then specifically for African American older adults. First, there are health-related comorbidities such as hypertension, obesity, cardiovascular disease that contribute to making African American older adults more vulnerable and susceptible to the impact of COVID-19. Additionally, these are compounded by the effects of race-related stressors, along with anxiety, depression, and grief that they may be contending with at this time. These conditions stem largely from systemic racial inequities that include residing in densely populated areas, poor or low-income neighborhoods with limited access to grocery stores or healthy food options, and limited access to quality health care. For African American older adults that live in the community, many reside in multi-generational households, which means that what affects those who are not older adults, such as work circumstances, which includes being underpaid. Also, many African Americans work in service industries such as grocery stores, warehouse workers, and those who are deemed essential workers and continue to work outside the home, as well as those who may not have access to paid sick leave or health insurance. And all of these factors expose African American older adults to the virus as it complicates their ability to engage in social distance. And as many of you may be familiar with, the confluence of COVID-19, along with recent race-related events, have been dubbed the double pandemic. And this is important because it tasks us with understanding the significance of the current moment in the lives of African American older adults. And so with that being said, I want to speak a bit more about the experience of race-related stress for this population, because it's often a population that gets left out of the discussion in terms of how they might be impacted by current events. Race-related stress, we know, occurs when an individual witnesses or experiences a racist incident that evokes social and historical experiences of racism. For African American older adults, these encounters or experiences have been accumulated over the lifespan and stored in memory and are relived with each new racist and discriminatory experience that they themselves may face or are triggered when they see these racist events on the media. So what that means is that for many, the recent killings of George Floyd, Breonna Taylor, and others, as well as the recent protests, evoke these memories, which are then accompanied by strong reactions and emotions. Again, these serve as added stressors that lend themselves to making them more vulnerable. And what that means is that they may increasingly begin to show PTSD-like symptoms, as well as general symptoms of stress and anxiety, as well as depressive symptoms as well. The way that PTSD symptoms may show up is in the form of hypervigilance and hyperarousal. There might be increased fear, worry, irritability. They may even have difficulty sleeping. And these are all in addition to flashbacks and intrusive thoughts that they may experience at this time. Increased level of anxiety may come about, especially when we are talking about grief. Many older African American adults have lost loved ones, their friends, neighbors. And so this experience of grief may lead them to question themselves, question their own lives, and question their self-worth. And this may also exacerbate depressive symptoms, which may show up as somaticization. And so this can look like physical fatigue, as well as stomach aches, headaches, and maybe an increase in chronic pain. And all of this goes to compromise the immune system, which further makes them more susceptible to COVID-19, along with any other illnesses that may show up at this time. So I will end my part of the presentation by saying that the combined effects of these factors are particularly important for us as aging and healthcare providers to think about, for us to consider, and for us to include in our conceptualization for treatment and care when we're working with African American older adults, not only those who are living in the community, but also those who are residing in residential facilities, such as nursing homes and assisted living centers. So now I will turn it over to Dr. Dodson to provide us with an in-depth discussion on depression, social isolation, and long-term brain health-related impacts.
Thank you, Dr. Adamoko. I want to start off by talking a little bit about depression in older African Americans, because this constitutes a group that is already vulnerable prior to the events of 2020, namely COVID-19 and the increase in race-related stressors. So estimates vary, but in general, the research shows that older adults are at greater risk for depression, and particularly older African American adults. So one study found that approximately 1 out of every 10 African American older adult in the community met criteria for depression, compared to 6.8% of white older adults. In addition, there's evidence that the severity of depressive symptoms tends to be greater in African American older adults compared to white older adults. There's also this idea of what's called subthreshold depression. So these are symptoms of depression that are clinically meaningful in the sense that they produce some sort of risk or impairment, but they may not meet criteria for major depression. And in older adults, this is actually the type of depression that's most common. So major depression is less prevalent in older adults, but subthreshold depression that's still clinically meaningful is more common, with some estimates as high as 1/3 of older adults who experience these symptoms. Unfortunately, that prevalence is also higher in older African Americans, and oftentimes can lead to a lack of diagnosis and treatment because of the fact that the symptoms don't technically meet criteria for major depression based on the DSM. So unfortunately, there is this issue of under-recognition as well as under-treatment for depression that can lead to a cascade of problems down the road. And there was a recent study that just came out that showed that Black participants were 61% less likely to report treatment, either medication or counseling for depression, despite having the diagnosis. So again, this becomes a very serious issue. This again could be related in part to cultural differences, for example, stigma related to mental illness, but as well, there's the issue of biases in the healthcare system that can contribute to this problem. So in part because of this inadequate recognition and treatment of depression, older African Americans tend to have worse outcomes of their depression. So we see greater disability in the sense that there's more impairment in work and social activities and everyday functioning. The prognosis can be worse, so worse response to medication, as well as less access to therapists who look like them that can be a problem that can get in the way. So there's an issue in terms of diversity in the field of psychology, particularly for clinical psychologists, and being able to provide care to people who prefer to have a same race psychologist. There's also evidence that African Americans have a greater chronicity of depressive symptoms. So the symptoms kind of persist for longer. And that also makes the person more susceptible to a number of negative outcomes, particularly when it comes to cognitive decline and dementia risk that I'll speak about in just a second. So what I've just talked about is really how you have these pre-existing disparities in depression that can impact the susceptibility to depression during the pandemic. We know from previous research that people who had a previous episode of depression are at greater risk for future episodes, particularly in response to stress. So right now, we've already heard about how there's these compounded stressors for African American older adults right now, which means that there's this increased risk, this extra vulnerable group, based on having this history of sort of disparities when it comes to depression. So further compounding this vulnerability is the effect of social isolation. So many of us, if not all of us, have both professionally and personally seen the effects of isolation due to social distancing and quarantine on mental well-being. And older adults tend to be affected even more, both because of their increased risk for COVID-19, but also because of the number of older adults who are in institutional settings. What's happening now is that older adults are being told to self-quarantine and shut themselves off from other people who might risk infecting them because of the awareness of there being this increased risk. And in long-term care facilities, a common practice is that family members and friends are not able to visit at all, and it's because of risk of spreading the virus. So this leads to a particularly difficult time for many older adults in being very isolated and restricted, even to a greater degree than what the rest of us are feeling right now. And this is, again, going to could interact with pre-existing vulnerabilities, because even before the pandemic, has been recognized that there's an issue of social isolation and loneliness in the older adult community. And some people have even called this a loneliness epidemic in older adults. So when we talk about that, loneliness is considered a subjective feeling of being isolated, whereas social isolation is the objective state of having few social relationships or few social contacts. And both of these things are happening more now during the pandemic. Increasingly, we've seen that these are serious public health issues that constitute risks for a number of negative outcomes. In the US, approximately 1/4 of community dwelling older adults are considered to be socially isolated, and 43% of them report feeling lonely. This is a problem because older adults who are in these situations, again, are at risk for a number of negative health outcomes. And what we see is that the research shows that actually older Black women are most likely to be socially isolated and then to have the lowest amounts of social support and capital. Studies have shown that people who find themselves unexpectedly alone, so not anticipated due to a variety of things, whether it be losing a spouse, separation from friends and family, retirement, etc., find themselves at increased risk. And I think we can all agree that this has been a time of unexpected separation and sort of a sudden onset of greater social isolation than one would have expected. So, and because of the restrictions of COVID-19, the usual ways of connecting and trying to maintain one's social support are not there. That can cause greater problems. So to speak really briefly about what I mentioned, which is that we have this increased risk for health problems, research has linked social isolation and loneliness to higher risk for a variety of physical and mental conditions. There's a 29% increase of risk of heart disease, a 32% increased risk of stroke, and a 50% increased risk of dementia that's been associated with social isolation and loneliness in older adults. These conditions can also contribute to high blood pressure, obesity, and weakened immune system, as we heard about earlier. And then on a psychological standpoint, we have an increased risk for anxiety and depression and suicide, as we've also already discussed. And then there's also even a 45% increased risk for mortality that has been tied to social isolation. So these issues, depression and social isolation, are interrelated because social isolation in and of itself can lead to depression, as well as anxiety and other psychological symptoms. And they're really important because they have both short-term and long-term health consequences that we've already talked about. In addition, it's important to note that depression tends to be associated with things like reduced adherence to medical treatment And in a situation where you have older adults who are vulnerable to, medical problems right now, then you have potentially this interactive effect of increased risk because of the immune system being compromised, the mood symptoms leading to a decreased adherence, and all the other factors that we've talked about that can lead to problems. So overall, this is, again, an issue in older adults in general, but particularly tends to affect older African Americans, particularly because of the increased risk for depression and social isolation. Before I hand things over, I just wanted to mention that one of the problems and the complications that can come with depression is that someone who develops depression now, whether it be a recurrence of previous depression or a new onset depression during this time, they become at an increased risk for future problems. Number one, we know that depression in older adults is oftentimes not treated effectively in the sense that the medications that are prescribed are oftentimes not fully effective, and psychotherapy, while effective, can leave lingering cognitive and brain changes that actually aren't really resolved with medication as well. And what happens with that is that you have these persistent changes to the brain that then put the older adult at risk for cognitive decline, for dementia, and other problems. So having really effective treatments right now, or prevention as much as possible, even though it's difficult right now, is really important in terms of trying to decrease this risk for long-term consequences. So at this point, I will wrap up this part of the presentation and turn this over to Ms. Telesford.
So thank you so kindly. Yes, so I've been asked to just express some of the challenges I've faced during the COVID pandemic, and even, I would say, during the racial tensions that are happening now in the United States. And some of those challenges were just basically a general sense of uncertainty, anxiety with COVID, and even trauma and hurt and anger, yes, some anger with the murders and systemic racism in this country. Also, some of the challenges, an inability to see friends and family, that was quite off-putting, if I may use that word, because we usually very frequently visiting our friends, visiting our family, not just on the phone naturally, but we were so free to walk about. And now we have to be safe and cautious and stay in, follow, good rules of what's going on so that we can protect ourselves and protect others. So also a lot of finances and businesses closings and closed areas where we are unable to go, to affiliate, to communicate. And all of these things added to the anxiety, or helped to cause some of the anxieties that we face as people right now, right here. And everybody is in the same predicament. Also, an ability to readily adjust. It took me 2 weeks when we first started quarantining. It took about a couple of weeks. I will honestly say it took about a couple of weeks for me to be able to adjust to this new normal way of how we were supposed to live. As an adult, as you see, I am an older African-American adult living in the District of Columbia, in a home. It took some getting used to, as I'm sure with everyone. I know that I'm not the only one, but yeah, that took some getting used to, or readjusting, or being able to say, okay, where am I? What's going on? How do I remedy this? I'm always one for remedy or learning or trying to get results, good results. Also, one of the other things was an inability to have or keep regular or even urgent medical appointments. So when we first started, just before the end of March, I had an urgent dental need, and I was unable to get through right away, but finally I did, and went to the urgent appointment and was able to get anything accomplished but some medication, which turned out to be adverse to my immune system. So that was very disconcerting. That was very not fulfilling for what I really needed to do at that time. So, and as we all know, we were unable to have just basic medical or dental appointments. We were all able to keep them, but I'm just giving you some challenges that I faced, and I'm sure many, many other people face them. We all hear and know that these are some of the things that are going on. So for all of this, some helpful strategies as well, I would say, that I even did for myself, just to keep it all in balance, all in check. Some simple things I did: go out twice or 3 times a week, well geared. You know, I had mask, I had my head covered. I didn't wear sandals. I wore my tennis shoes just to ensure that if I'm walking, you know, things covered. Gloves, I went on well mask because certain underlying conditions, as many, many, many of us do have. And I wanted to be safe. I wanted to have others safe. When I come back home, I wanted to have the people here safe. So, but simply things, still go out. Even though it was challenging, sometimes going out to do the necessities was because everybody's in a frame of mind of some panic and, oh my goodness, what am I going to do? I don't have enough. I better go quickly and early because I'm not going to have enough, and I'll make you like toilet paper, paper towels, and on a serious note, cleaning solutions and things like that. So all of that you're met with. We were met with some of the challenges, but I still went out because it was for sanity. It was for fresh air. It was for things that would assist me still cope, to still say, okay, we're living in a dangerous time, an infectious time, but still we are human, we are people, and we must, you know, still see or connect in one way or the other humans, other people, not and observing the social distancing rules, obeying the rules of our officials. Another thing that I did that I found so very helpful, most helpful actually, as I still we continue to do Zoom with my church, and I was able to see them. I wasn't able to hug, but I was able to see congregants and be able to communicate that way. And that was of great importance. I did walk, I did do stretches when I wasn't able to go out to walk. We do have a front porch, so I would go out and stretch and do jumping jacks, you know, things that as an old American, we remember doing what we would call calisthenics. So little calisthenics or little things that would stretch the back and the neck, or, you know, do different things that would assist you in getting a little more mobility rather than just sitting and eating or sleeping and not being active. So those are things that I used to help me to cope. Reading, I read more, I researched, I watched comedic videos. We all need some good comedy during stressful times, and even did a little more resourceful in searches, did look at videos that were resourceful, that helped me to learn how to cope or learn what to do and what not to do during this time. And to tell others, did you hear about this? Did you see this? Maybe we can take a little more, get our immune systems a little better, take a little more immune-friendly foods and herbs and vitamins and things of that nature. So that was key, absolute key also. And Messenger, my family abroad, abroad and various families and friends here. Lastly, well, I checked on neighbors and friends. In part of my family, I do have someone who is incapacitated totally. So that was another area. I would go and check for them, ensure that they were well, kept the distance, masked, gloved, head coverings, everything that was necessary, so that we all could be safe, but that you see each other, we still recognizing, because for as seniors that are in not institutions, but in healthcare, home care, it's difficult when they're unable to see family. And this was in a house home at the time, so I was able to go sometimes. So all of this assisted me to keep a sense of normalcy. There is such a need in the African American community, I'll speak of specifically, for persons who are in some type of trauma, one way or the other, to really get information and appropriate that information of how to be safe and well as best as possible.
Thank you so much, Ms. Telesford, and thank you for getting us started. I want to spend a few minutes for us to begin the conversation on how to address many of the challenges that have been outlined so far. And also, a lot of the things that I'm going to be speaking to are things that, as you heard from Ms. Telesford, as things that she has found to be helpful. And I think it goes without saying that given the challenges that are currently being faced by African American older adults, that it's important, more so now than ever, to support them, to strengthen them, and provide coping skills to help to enhance their resilience. And the way that this might look is first maybe providing some psychoeducation, helping them to understand how these issues, COVID-19 related as well as race-related stress combined, may be impacting their mental health and physical well-being. So whenever possible, being able to provide them with that information. And along with psychoeducation, being able to provide an empathetic space. And what this allows us to do is to be able to empower and support them in being able to get whatever it is that they need. This includes assisting them in naming how they feel, validating their experiences, validating their feelings and concerns. And it's also important for us to know as providers that they may not be interested in sharing this information with us, and that is okay too. And I think it's important for us to let them know that. And if they don't want to share that information with us as providers, then being able to find who is that individual that that person is connected to, or that they have developed a close bond with, that they feel comfortable and safe to be able to engage in those conversations with. It's also important for us to provide them with resources and strategies that enhances their resilience. I mean, many African American older adults enjoy art, music, books, and TV shows, as well as podcasts. And these may help to evoke more pleasant memories and emotions, and it'll help connect them with their culture, engaging them in practices that affirm their humanity and that is more in line with their cultural values, and brings about a sense of racial pride for them and celebrates the joy of being African American. And so we want to be able to encourage them to use these resources and practices in their care. And I think Ms. Telesford also talked about the importance of engaging spirituality. Many have faith value or spiritual values. And so during this time, being able to provide them with access to technology that allows them to be able to participate in it. There are many online church and spiritual services, so assisting them with setting up the technology so that they can participate in it regularly. But this can also be through providing them with spiritual scripts or books or CDs that they may find to be helpful. And also, whenever possible, being able to engage a spiritual leader. And this can be a pastor or a priest or even congregation members who may be able to call or video conference with the older adult regularly. And as it's been mentioned, for a lot of older African American adults, they feel particularly disconnected from their family because they're not allowed to be able to visit them, especially those who live in residential facilities like assisted living centers and nursing homes. But it's really, really important with older African American adults to be able to encourage that connection to their family and to kinship networks, which is of value for them. And so it's important that we remain in community with family members and loved ones and involving them in their care as much as possible, whether that is, again, providing access to technology so that they could video conference them or call them as frequently as possible. And then lastly, I want to mention that as providers, it's important that we always consider our cultural backgrounds, our identities, and its influence on our own beliefs and values, assumptions, and biases. In psychology, we always talk about the importance of cultural competence in working with diverse populations, just generally. And so from this lens, it's important to understand how our own culture might interact with the cultural background of the African American older adults that we're working with, the ways that the cultural dynamics between us may trigger the symptoms and experiences that we've just described here, and to be able to see how, when they are aligned, how we can use that to be able to provide them with additional support. And what I mean by that is, how can we use our cultural backgrounds to be able to engage in a process to be able to support them? And if they are not aligned, being able to engage in that self-learning process, being able to learn the history of African Americans in this country, being able to learn about experiences not only that deal with racism and discrimination, but also how they've contributed to survive and thrive in many ways in this country. And so with that being said, I'm going to turn it over to Dr. Dotson, who will also continue with this conversation on strategies and things that we may do to support older African Americans during this time.
Thank you so much. And those were really great suggestions, that some of which overlap with a little bit of what I wanted to share today. I want to, in particular, talk a little bit more about some of these sort of self-care sorts of and healthy behaviors that we've been talking about. And that can be things like exercise or good nutrition that we know are really great from a health standpoint, but that also are important for maintaining balance, building resilience, and helping encourage the clients that we see to be able to manage the stressors right now. One thing I wanted to add about that is that there is a lot of research that shows that these type of healthy behaviors not only are beneficial for mental well-being, but actually are directly promoting brain health, and in that way are beneficial for cognitive functioning. They can actually cause changes to the brain in the sense of improvement in the efficiency of how the brain works, promoting neurogenesis in different parts of the brain, or kind of new growth of cells. And so this is important for addressing what I mentioned before, which is that when you have these times of depression and social isolation, there's this increased risk for dementia. And part of that seems to be due to the fact that there's these neurobiological changes that are happening in the brain in a structural and functional standpoint that then put the person at risk. But these sorts of behaviors can actually sort of help to counteract that change, or those groups of changes in the brain, and may be able to reduce the risk that can come from experiencing these times of depression and loneliness. So on both a sort of mental and overall well-being level, as well as on a brain and cognitive level, these sorts of things are really important, and definitely are the sorts of things that we should be recommending to the African American older adult clients that we're seeing. I also want to reiterate the point about staying connected through technology and trying to find ways to help our clients, our patients, learn technologies or find ways that are not as demanding on their technology skills to be able to keep in touch. And so we know now that it's really great that most cell phones you can do video messaging or video calls through Skype or the apps that can be fairly straightforward. But taking that time, if necessary, to help walk through how to use these sorts of technologies, or else connecting with a family and to make sure that someone's helping to make that more accessible for people, I think is a really important point as well. And again, that will help with that social connection that we know is so important. That also is helpful when it comes to thinking about referring people for mental health services if you yourself do not provide those services. So many people now are offering teletherapy and in some cases even offering neuropsychological testing through telehealth. So we have this opportunity for still receiving some of these important aspects of healthcare through telehealth. But again, it will be useful to try to help as much as you can with different patients navigating those systems. A few other suggestions I would want to make. So one is that I think it's important for any kind of psychological distress or symptoms that are being experienced to be taken in the appropriate context. And what I mean by that is that some people might feel like something is wrong with them or something's off if they're feeling depression or anxiety. But in reality, that's a really common response right now. And so I think some degree of normalizing symptoms for people who are experiencing a more expected response to the current stressors is really important. It helps to decrease stigma. It helps to avoid over-pathologizing if there is not an actual diagnosis that's there. So most of the polls that I've seen have shown that at least 50% of adults are reporting having mental health concerns. And that's just across the age range and could be even higher in older adults. So I think that sort of information and helping people to see that they're not alone and that this is an expected response is helpful. But having said that, there are some people for whom this can either become prolonged and turn into a depressive disorder or anxiety disorder, or they're having a recurrence of previous episodes. And that's important to identify as well. And this is where it really requires having that clinical judgment, if you are a psychologist or other mental health provider, to be able to distinguish between a major depressive disorder or something that could be, as I mentioned, a subthreshold depression, meaning that maybe they don't quite meet the criteria for major depression, but you clearly see all the impairment that's there, versus someone who's just having a stress response, an anxiety response that is more typical. Again, that's something that requires clinical judgment. There's no necessarily gold standard. We do have a DSM as some guidance for looking for the overall group of symptoms that are required for a diagnosis. But I would encourage everyone to consider what we talked about before, which is that not meeting criteria for major depression does not mean that someone is in the clear and not needing to have some sort of treatment or referrals that are necessary. So finding that balance, I think, is really important. I also want to just mention a couple of things to consider if dealing with someone with dementia and with their family. The CDC actually has some great guidelines for family members, caregivers of people with dementia. And just keeping in mind if someone has dementia or other causes of cognitive impairment, that you want to be mindful of the fact that COVID-19 can look different. A lot of times what you might see initially are more confusion and agitation. Those sorts of things can happen in dementia in general, but if you see a sudden onset of that at this time, it's definitely a good idea to get that checked out. And so I think that telling that information to the family members of people with dementia is really important. Some of the basic recommendations, like thinking ahead about prescriptions, putting reminders about hand washing since there's memory impairment, those sorts of things are all really helpful, and again are easily accessible by families on CDC website and other government websites as well. And we also have great recommendations for some of these issues on the APA websites. So I think just overall making sure to point the families to specific resources for dealing with dementia at this time will be helpful. That will provide more detailed recommendations than some of the general recommendations that we're giving. And then on the side of the families, I think it's also important to remind the caregivers that they themselves need to, as much as possible, try to practice self-care. We know that caregiver stress in and of itself can predict depression and other issues in the patients with dementia. And so the more the caregivers taking care of themselves, the more that everyone involved can have some better outcomes. So I'm going to stop there, and I think we've now reached the question and answer portion.
That's correct. And so I'm going to pose a couple of questions to our presenters. And if we're unable to answer all of the questions, we will definitely provide the answers to the questions when we send you the transcript and resources and other data. About 2 weeks from now, you'll probably receive those. So Dr. Dotson, I was just going to start with you. So what are some recommendations to help older African Americans overcome potential barriers to self-promoting behaviors, such as limited financial resources?
Yes, those kinds of questions come up a lot, and particularly when it comes to the financial side of things. For me, the main things I recommend for people when it comes to brain health, which is related to everything we've talked about, are exercise, cognitive engagement, keeping their mind stimulated, and social connections, as well as nutrition. And most of those require some degree of financial resources to be able to do it in the optimal way. People think of, going to a gym or buying gym equipment, what have you. One of the things I really try to emphasize is that a lot of things that are really good for us can be done for free, and some other things can be done really cheap. So things like exercise, I'm actually impressed by how many actually good quality YouTube videos there are for home exercises, and that's actually come out even more now. There are people who offer either free or really cheap online classes and things that can be done at different levels of functioning. So I think that taking advantage of the availability of things like that online is great. Also, keeping in mind that right now it's getting hotter, so that might need to be considered the time of day, but walks are free. Walks are a really great way of getting exercise. It can be done even in the midst of trying to have social distancing, and can also be good from a mental health standpoint. So that's one way of overcoming that. And then I'll really briefly say as well that when it comes to the nutrition side of things, which also people sometimes feel like eating healthy is more expensive, but I think that being creative about how to balance one's plate with, more fruits and vegetables, less meat, actually can be done even on a limited income. And so encouraging that's important.
Mm-hmm. And Ms. Telford, I wanted to ask, because the question came in, you had mentioned that you do Zumba. Was that in person or was that online?
No, actually, I do a lot of conferencing and connecting through Zoom, not Zumba. But I do walk and do some exercises right out front on the porch.
So, Francis, what
Yes.
resources are available for aging and healthcare providers looking to increase cultural competency in working with this population?
Sure. I think kind of similar to what Dr. Dotson said, we're lucky to live in an age where there's a lot of resources that's available for free. And especially, I think that APA, the Office on Aging, for instance, has a lot of great resources online that can be accessed. Also, the Association of Black Psychologists, as well as BEAM, which stands for Black Emotional and Mental Health. They are also a wonderful resource for accessing information in working with this population. And actually, we do have a slide that will list all of these resources for mental, as well as mental health services for older adults as well, that we'll share immediately after this Q&A.
Mm-hmm. So we have a question. I know this can be an entire webinar, but how would you adapt depression treatment or interventions to African American older adults?
That's a great question, and absolutely could be a complete webinar in and of itself. So I think there's a couple things to consider there. So one is that it really depends on the individual, the severity of their depression, and if there's cognitive impairment present as well. All of those things can impact whether or not which type of treatment sort of is most helpful. I think if you take the more sort of basic or more common treatments, such as types of therapies, such as cognitive behavioral therapy or interpersonal therapy, I really think what the research shows is a lot of what Dr. Adamoko was already saying, that bringing in things that kind of emphasize cultural values, bringing in aspects, whether it be spirituality or dance, whatever it is that is helpful, and encouraging those sorts of lifestyle things that can be helpful for mood, as well as can create connections within therapy sessions, I think are really helpful. So that would be my sort of quick answer to, again, what could be an hour-long discussion.
How can we balance our work as providers along with being allies in the community?
I'll just share a couple of thoughts there. I think that's a really great question, one that probably doesn't have a simple answer. But I do think that in general, doing community outreach, connecting more with whether it be churches or senior centers or other community groups, in order to do anything ranging from, educational sort of talks, presented in a level that's for a community, not the research talk that we might give in other settings or to other professionals, I think is helpful. Providing lists of resources and referral information that can then be given out. Having that exchange back and forth allows us to use what we sort of do professionally on an individual level to start to connect with the community in general. So that's one suggestion I would have.
So we have some very good questions. How do you work with clients or patients who perpetuate racist views, especially those against older African-American adults?
Another really good question, and one that I had a conversation about this actually with some of the trainees in my program, that I think there's a really important aspect of needing to be aware of our own stimulus value in the room and the difficulty of encountering someone who is expressing beliefs that are clearly counter to what we feel. And I can say from personal experience, because I've had a couple of really dramatic examples of that, that can be very difficult to do. How to handle that? I think the first thing that I try to think of is my ethical obligation to provide the care for the person regardless of views they express that I find to be abhorrent in some situations. But at the same time, trying to, particularly for me as an African-American woman, trying to make sure that I am, I guess, behaving in a way that challenges the beliefs that they might have. And so that means trying to stay objective, approach the conversations with them from the clinical perspective and not going to the personal level, which is similar to what we would have to do with any difficult client or patient. Again, that's easier said than done, but that would be my brief answer to that.
Yeah, and I also want to add to that. I think it goes, I think that question, and I love that question because I think it goes not only in terms of our work with someone who expresses that from a client perspective. Also, I can imagine if you're working in a facility where you have multiple healthcare providers who may also have different beliefs or practices or values around how to work with people from diverse backgrounds. And so I wanted to kind of take that approach. It's not really the question that was asked, but I think that that's also important as well. And I think it speaks to just the amount of education that we might need to offer as providers who have more information about these areas and these topics, being able to always be empathetic, but also providing education, because a lot of it comes from a place of not knowing, and not that as a person of color provider, you should be obligated to do that education work, but I think it's something that has to be taken into account. And also, in addition to that level of education, like Dr. Dodson said, being able to understand that this is where the person is at. And so depending on our work with them, being able to challenge that softly, but also recognizing that we may or may not change their minds. And so not engaging in a way that is going to be disruptive to care.
We thank you all for joining us, and we look forward to additional webinars in the future. So thank you and have a good day, everyone.